What is cortisol resistance? A rare genetic disorder where the body is unable to respond to a hormone called cortisol. The body produces excess cortisol to compensate for this effect.
Hey guys, it's Dr. Wiggy. I just wanted to check in with you today and talk about the relationship between thyroid and cortisol, because we see a ton of people that come into our practice and they're complaining about being fatigued. And one of the things that we usually do first is to really make sure that the thyroid is optimized. And when we optimize the thyroid, people do seem to feel better right away. You know, their energy is improved, they have better thinking, you know, they just feel better. And this usually seems to last for most people it seems to do the trick. But for some people, in about 3 or 4 weeks, they start to kind of backslide and they start to feel fatigued again. And we see this happen fairly often. And what seems to be the case is that, yeah, even though their thyroid is optimized, they're still having some thyroid resistance, and it's just not acting enough on the cellular level. And what seems to be happening in this case is that their cortisol is also very low. Now, the way that this works is that your thyroid cannot work at the cellular level if you do not have adequate levels of cortisol. The way that this works is that cortisol actually works on the thyroid receptors and makes it so that they can accept the thyroid hormone, and so the thyroid hormone can do its job. So oftentimes what we do when we have people that are coming in and they're fatigued again, even though they're on thyroid replacement, is that we do have to check their adrenal glands. And if their adrenal glands are off, then we have to support their adrenal glands and get their adrenal glands healthy again in order for their thyroid to work. So, like I was saying, you have to look at both the thyroid and the cortisol if you really want the thyroid to be working effectively and to be really doing its job. So, if you have any comments, please send me a comment below. Otherwise, please subscribe to my YouTube channel. We'll have a lot of other great videos coming out. Otherwise, hopefully this was helpful, and I'll talk to you later. Be well.
Physical examination. Physical examination revealed cachexia and melanodermia, predominantly on the cheeks, nose, and chin, around the mouth. The patient was awake and alert and had a temperature of 38 and a pulse of 90 beats per minute. His blood pressure was 105 and 65 millimeters of mercury.
Observational studies have found associations between subclinical thyroid hypofunction during pregnancy and adverse outcomes, including pregnancy and neonatal adverse events, lower IQ scores, and impaired psychomotor development. Some guidelines recommend routine screening for subclinical thyroid disease and treatment during pregnancy, without strong data to suggest that this practice improves outcomes. Investigators conducted 2 randomized placebo-controlled trials at 15 U.S. centers. Women presenting for prenatal care underwent thyroid screening and enrolled in one trial if they had subclinical hypothyroidism, elevated TSH and normal free T4 levels, and in the second trial if they had hypothyroxinemia, normal TSH, and low free T4 levels. Women in both trials were randomized to receive either levothyroxine or placebo. The mean gestational age at randomization was approximately 17 weeks in both trials. Levothyroxine doses were adjusted to achieve target TSH and free T4 levels. The primary outcome, the IQ of the children at 5 years of age, did not differ significantly in either trial between those whose mothers were assigned to levothyroxine during pregnancy and those whose mothers were assigned to placebo. There were also no differences in secondary outcomes, including cognitive, motor, language, and behavioral scores, and rates of adverse pregnancy and neonatal outcomes. The authors conclude that levothyroxine treatment, starting on average at about 17 weeks of pregnancy, for women with subclinical hypothyroidism or isolated hypothyroxinemia, did not lead to improvement in children's neurodevelopmental outcomes or differences in pregnancy or neonatal outcomes. Full trial results are available at nejm.org.
Treatment. Hydrocortisone was administered to address the peripheral resistance to cortisol. The patient received antiretroviral therapy with tenofovir, entricitabine, and efavirenz. His condition improved and he was discharged 4 weeks after hospital admission.
A viewer asks, are there any natural treatments for thyroid problems? Well, yes, there are. And first of all, if you have low thyroid, you may experience fatigue, low endurance, dry skin, hair loss, easy to gain weight and hard to lose weight. If you have some of these symptoms, talk to your doctor and see about getting your thyroid tested. You want to measure your 2 thyroid hormones, T3 and T4, and TSH, which is the way your pituitary looks at how your level of thyroid is. You know, in terms of natural treatment, a more integrated approach is to support the body with both a combination of T3, T4, which can be used with natural thyroid, which is a prescription thyroid as well, and that there's also synthetic thyroids, which are primarily T4, and there also is T3. So we really want to support both those. Of course, the thyroid functions when it has all the nutrients it needs. Iodine particularly, amino acids like tyrosine, and also selenium we need to convert our T4 to T3. So if selenium is deficient, we may not make enough T3 and we may feel hypothyroid or low thyroid even though our numbers could be okay. We want to look at iodine sources, which can be seaweeds. I think seaweeds are an important part of the diet. They're very rich in nutrients, very low in calories. They support our hair and our whole body. And also ionic trace minerals, which we use to help support hydration, but they have some iodine in it, and that helps also support the body. So those are some basic ideas on supporting thyroid and checking your thyroid. And again, it's important to talk to your practitioner about whether thyroid is an issue for you. And there also can be depression and mood disorders from people with low thyroid. So really check it out if you have any of these conditions.
Rhonda S. from New Brunswick suffered from Hashimoto's thyroiditis for 17 years before finding the hypothyroidism revolution, and she's overjoyed, as you can see here. I love this program. After 4 months, I have lost 17 pounds. My energy level has risen dramatically. My blood work shows improvement in all tests, and I feel like I'm living again. After suffering from complications like bloating, high cholesterol, and major depression, etc., and seeing more specialists than I can name, your program has been a miracle for me. My overall health is now better than I have ever experienced. Thank you so much. With results like these, the hypothyroidism revolution is designed to eliminate all of the underlying causes of your hypothyroidism. For example, on page 143, you'll discover the foundations behind my strategic thyroid balance principle. This includes the 4 essential rules to a balanced thyroid diet and the exact timing necessary to unblock and reactivate your thyroid hormone pathway, along with the exact steps to personalize your diet for faster results. Starting on page 123, you'll discover exactly how to naturally rebalance your thyroid suppressive hormones and break the dangerous hypothyroid cycles that are holding your thyroid hostage, including special considerations for Hashimoto's thyroiditis, radioactive iodine treatment, thyroidectomy, and more. On page 102, you'll also find the 6 thyroid-boosting power foods to kickstart your thyroid and metabolism and have you feeling great in no time. Plus, you'll see the quick start guide that takes you by the hand and walks you through the entire system step by step and day by day. And there's more. You get the complete strategically balanced thyroid boosting cookbook full of balanced recipes, making your meals a piece of cake. No pun intended. And to make it even easier, you'll also find my done-for-you meal plans and shopping list, so you don't have to think about what you're going to eat. Plus, you'll also find a number of other resources all designed to help you quickly and permanently put an end to your hypothyroid condition. The Hypothyroidism Revolution is by far the most comprehensive and easiest thyroid program to follow. In fact, many of my clients report a complete return of their energy levels faster than they could have ever imagined, and revolutionized the diet and health industry.
Results. With proper therapy, the evolution of peripheral cortisol resistance can be slowed, and this slowing is reflected in the gradual decrease of abnormal skin pigmentation, which occurred in the patient.
Hello, I'm Dr. Derek Keats, a former professor of biology, and I'm going to spend a little more time with you on the human endocrine system. This time we're going to look at the hypothalamus, the pituitary gland, and the thyroid, and how they all work together to control important metabolic functions within the body. Let us first look at the hormones that these 3 components of the endocrine system produce. The hypothalamus produces thyrotropin-releasing hormone, TRH, and somatostatin. One interesting aspect of TRH is that it is only 3 amino acids long, making it a fairly small biomolecule. The pituitary gland produces thyroid-stimulating hormone, or TSH. It also produces follicle-stimulating hormone, luteinizing hormone, prolactin, and growth hormone. We'll come back to these later. The thyroid gland produces thyroxine, also known as T4, and triiodothyronine, also known as T3. These are not the only hormones involved in the central nervous system components of the endocrine system. They're examples, and they're the examples that you need to be familiar with for your grade 12 syllabus, and that's why we're covering them here. They're also among the more important and interesting components. And here we look at the relation among the hormones